I'm super excited because, yes, I think everybody, yeah, I was born here and I grew up here, and I was engaged in a lot of research early on. Everything I did was all asking questions in a controlled kind of environment. Now I've really worked to transitioning to translation of this, and what does this look like in the wild? And when I say in the wild, I really mean trying to meet people where they are. And so I'm really excited because we have a very diverse panel here, which I'm super excited, but in each and every way, these four people are change makers. And many people everyone out here is another kind of change maker. But these are change makers who I really see as trying to meet people where they are, trying to help people within the contexts in which they live. And so it's so cool because with Sanjay talking about living in nature, it's like where people live. When people talk about optimization, that's what this panel's about in different ways. When we talk about just being with your people, I love, this is my people too. And so it's really exciting. I'm very excited to have this. So I want everyone to have a lot of questions because we're gonna try to get to a lot of questions. Again, a diverse work and diverse perspectives. So I'm gonna introduce everybody and then we're gonna kind of kick it out. So first we have Liz Feld. Liz Feld is the CEO of RADical Hope. RADical Hope is a nonprofit that is dedicated to improving the lives, the brain health lives of our youth, and I should say our lives, brain health and regular lives, of our country's youth in measurable ways. She has done, extensive work between communications and politics and policy and advocacy in so many different ways, also from Autism Speaks, now to RADical Hope. Super excited to have you here. Then we have Dr. Walter Greenleaf. So Walter is, I always think of you as the grandfather of VR. And so that's really exciting because I think we got to see a lot of cool technologies yesterday. Walter has really been a leading authority in digital medicine and VR. And so it's cool to see that with the pandemic, there was obviously a massive need. Already it was coming, but now we really have it. And meeting people where they are, and especially our younger people who are so tech-driven and motivated, is really, I think, very exciting. And so Walter's at Stanford, and thank you for being here. Then we have Dr. Jason Bailie, and Jason is a neuropsychologist who is the senior clinical director at the Defense and Veterans Brain Injury Center at Camp Pendleton. He's at the Intrepid Center at Camp Pendleton. So he is involved and leads efforts, both research and clinical programs with active duty service members. Awesome. Okay, next is Dr. Upali Nanda. So Upali she just recently dropped her research, a research from her title, but let me get it right, I'm gonna read it right. She's the Global Sector Director of Innovation at HKS. And her forte is really leading teams to look at and investigate the impact of physical space and design on human health and perception. And so I know, hopefully everyone's gotten a chance to, over at the Brain Performance Institute building to see the exhibit, the HKS exhibit, but that's another example of taking this into the wild. Okay, so thank you, distinguished panel. First, I just want each of you to kind of kick us off with, just take 2 minutes, like 1 to 2 minutes, and talk about why do you do what you do? What is the whole impetus for what you do? We'll start with you, Liz.
Thank you so much, Jen, and I don't know if Sandy's back. Oh, there she is. Like Admiral McRaven, I do what I do right now because of Sandy, but I got involved with this family foundation back in 2018. I know the family, they lost their son to suicide while he was a junior at Gonzaga University, and like so many young adults across the country and around the world right now, he was experiencing all of these challenges that frankly should never rise to the level of the tragic outcome that he experienced. And so much of this had to do with just lacking fundamental life skills, skills to manage his own brain health, his own relationships, his stress, his decision making. And the family wanted to do something that could have really direct impact right now on so many other young adults. There was not an evidence-based program that was really getting right to the heart of all the issues that this young man experienced. And I got on board to lead this, and one of the first things I did, thanks to my very good friend and colleague Jeff Ling, was come down to meet Sandy, and then Ian, and then Admiral McRaven, really to find out how collectively we could help these young people understand that they have control over their own lives, over their own brain development, over their own health. And it was really incumbent upon me and us to come up with a program that could reach as many of these young folks as possible to teach them all the resilience skills, the connection vehicles, and other things that they need so that they can live full lives.
Thank you. Okay, Walter.
Well, it's always a challenge for me to say why I am working on what I'm doing, because I'm very horizontal. I work as a psychophysiologist, as a medical product developer, and as a business advisor. But what the passion that drives me is, I think, I spent some time at the Stanford Center on Longevity running the Mind Division. I think it's around the time I first met you, Sandy. And I became very conscious of the need for us to improve issues related to cognitive aging. We all know in this group that there's a tidal wave of which may be more impactful upon our economy and our society than anything else, with an aging population, with the concomitant rise in percentages of neurodegenerative diseases, smaller family sizes. So I try and use the skills and the relationships and the experience I've had to help address that issue. As part of that, I got involved in the, as you mentioned earlier, the field of working with virtual reality technology back in 1987. So for me, it's been a very exciting time to see it move forward. I also, around that same time, started my first medical product company, which was using an Apple II computer to score psychophysiological data from our sleep research lab. And I became convinced that I could make more of a contribution by publishing products more than by publishing academic articles. So I spend most of my time right now trying to address issues where we can use the power of immersive environments, that's the term we're starting to use, to impact people as a method of adherence and as a method of engagement, to change behavior, to change attitudes, to provide both therapies, better assessments related to physical and mental health and well-being. So I'm passionate because I see needs and I see pathways to get there, and some technologies and some wonderful colleagues, some of whom, many of them, most of them are here, can help move this all forward. So it's an exhilarating time. There's problems to address, but there's pathways to do it.
Thank you, Walter. Jason.
Thanks. I was just kind of going over my head on that question, trying to figure out exactly what the impetus is. And I've had the privilege for over a decade now to work with the military, and when I started, it was been around 2010, 2012, I was doing a lot of work, direct clinical care with service members who had recently separated for medical issues. And I remember sitting across from them, and they had experienced really severe trauma, really severe brain injuries, and they were floundering, trying to make it back in the world. Some were trying to make it back into the service, and I was really struck because we were the same age. I was 21 when 9/11 happened, and I went to graduate school. They joined the military, and they fought and they sacrificed, and I remember this kind of very sad feeling that I don't know how to help them. Like, the tools that I had at my disposal were not good enough. And I had the opportunity to work with no longer the DivBIC, we are now the TBI Center of Excellence. And I've had the opportunity to develop research and to lead an agenda. And as the conflicts came down, there was more interest and more opportunities, not in just assessment and triaging, but we actually could develop new ways, better ways to care for our guys. And we recognized that it wasn't just this simple injury, right? We talk about brain injury, but there's so many other things that were impacting these guys, from moral injury to post-traumatic stress disorder to substance abuse, just to the facts of life, right? That these guys had to experience some real tragedies. And so that's how I kind of got in connection with Center for BrainHealth and started developing novel interventions, way to optimize our rehabilitation. The DoD, the military, has invested a lot of money and resources in trying to help our guys. But the reality is, despite our amazing centers and our great clinicians, we still fail a good number of guys. And so I've really, really focused my efforts and my agendas to find better treatments, to optimize care, to get people back to duty. And if we can't get them back to duty, at least get them to a place where they can leave and they can go back to their civilian lives and they can function. They have the resources they need.
Thank you. Okay, Upali.
All right. Maybe I'll answer your question with a quick question to the audience. Raise your hand if you're nowhere. No one? You know, one of the simple truths of our life is we're always somewhere, right? We're always somewhere. Right now, we are here. We're in an environment of sorts, right? Our brain is in our body, and our body is in an environment. And that's one of those absolute truths. I grew up as an architect, and it always surprised me that those of us who build with the desire of making an impact on humans can be so removed from that impact itself. I chose the path of research because that platform of truth that Sanjay talked about is a platform of truth sometimes we don't see about how much our environments matter. We talk about forest bathing, but we are bathing in our environments 24/7. And any environment you're in, Dan, I'll steal your words, any environment you're in has been designed intentionally or not intentionally. And what we are basically saying is nature is a better architect. That really shouldn't be the case. So I do what I do, and we do what we do, because we believe the environment matters. We believe it has a direct, measurable, meaningful impact. And it should make your job easier. It should make the job of what we are trying to do, and it should actively be building our brains.
Thank you. Yes. I think it's interesting to think, I think some of the themes that kind of come, or a theme that's come through is the need for tools, the need for resources. Because as you said, Liz, this young man didn't have. Jason, you're saying we fail, like we continue to fail. I mean, Walter, that's what you're trying to do with digital medicine and providing other opportunities, and that's what you do as space. What do you guys think is one of the biggest, what's within your own context, with your respective areas, what's the biggest hurdle? What's the thing that we really need to overcome in order to get to better?
Well, from my viewpoint, there's a lot of good news. I think that we finally have some tools to both collect through wearable sensor technology and leveraging the built environment and using it as a way for us to interact with effective computing and being able to measure emotional and cognitive states more accurately. We now have more tools to measure and to dynamically impact. But the challenge, I think, is our existing momentum and infrastructure. We have fantastic new tools to help with both on the wellness and on the clinical side, both preventatively and therapeutically and new assessments. But we don't have the business model to propagate and to support that. And it's... Walter,
can you speak up just a little bit?
Sure. Okay, I just finished saying something really exciting and important, and I'll try and say it, and I won't restate it, but I will continue to speak a little louder. I think what the challenge we have, bringing the good news, the new methods we have of making a difference, the challenge is the momentum of the existing infrastructure, and it's hard to propagate change. It's hard to move things in the right direction. So I think it's really it's a design and re-engineering of the existing pathways we have for health and wellness.
Thank you. Anyone else have anything to say?
Well, it depends, in a way, what you mean by tools. You know, we, when the foundation started, we didn't know what we were going to do, but we knew we wanted to help these young adults. So we ended up partnering with NYU to develop a program that's, very structured, 4 weeks around strengthening connections and building resilience. But we went out and talked to hundreds of young adults around the country to find out what their common stressors were, why they weren't accessing the kinds of tools and resources that are out there, what mattered to them, what kind of program they would come to. And what we found, and this is everything that's been said over the last couple of days, is number one, they just lack meaningful connections in their lives, meaningful connections, and they know what the difference is. They know what the phone connections are, and they know what the real human connections are. They also lack the skills that they need to manage just the daily challenges that they're facing. They don't have the self-efficacy, they don't trust themselves, and they don't feel like they have any control over the really big things, climate change and racism and gun violence. So they lie awake at night worrying about that, but they're not finding meaning and purpose in the smaller things that would make them feel like they had control and that they have the tools themselves. So much of the work that we're doing, that we developed, it is directly in response, and Yolanda talked about this yesterday about being student informed. It was developed by exactly what they told us in their own words that they needed, that they know they don't have. And there are tools like Walter's developing now that are out there that they don't even know how to access. They're so overwhelmed and they don't trust themselves at all. So a lot of the work that we're doing is really to teach them, help them, develop the tools and find the tools because they're there. It's incredible the stuff that's out there.
Yeah, just to add on that, I think the word that comes to me when you're talking is empowerment. And I think that one of our biggest challenges that we face in the population, largely, military included, is we overcomplicated things, right? We've just overcomplicated things. And listening to Dr. Gupta, you know, it's like there's almost an essence of we need to get back to some basic roots about health. In the military, we love to chase shiny objects, and I think that's the case for the rest of the world as well. You know, it's like, oh well, this is the cause? You know, right now we're chasing blast exposure and repetitive blast exposure. We were chasing mild TBI and concussion for a while. We've been chasing post-traumatic stress disorder for decades. At the end of the day, what we need to convince our people to do is we need to convince them to get to the simple solutions, right? Get to the connectedness. Get to ways to improve how we think about problems, or ways to find new solutions, not to just do the same thing over and over again expecting different results. We need to take care of our bodies. We need to move. I have a very large grant right now. I could boil it down into a lot of complicated theories about sympathetic and parasympathetic nervous systems and brain-derived neurotraffic factors and all this stuff. At the end of the day, the grant's about moving their body. It's using subsymptomatic, progressive exercise to optimize treatment outcomes. I give them a personal trainer. Right? And guess what? It helps. Guess what? They work. Because when we move our body, we improve our brain, we improve our heart. But most important, I think we all can recognize, whether you have a healthy brain or injured brain, we exercise, you feel better, right? So some of these basic concepts, having relationships. I wrote down from Dr. Gupta, I'm like, I'm going to live my life. My advice to every single person is going to be like, take a brisk walk with a close friend and talk about your problems.
Yeah, right.
And that's what they say. The kids all say that they just want a friend. We can talk about meaningful connections and all the other language behind it, but that's really what they want. It's what they need.
And so I'll add to that how easy are we making our cities and our neighborhoods to have that brisk walk, to have the sidewalk, to have the walk, to be even able to see where's the friend. We designed for backyards. We designed to say, come in, hang out in the back with just your core family. Like, for everything that you say, my head is going to, the hurdle is, we are not setting environmental affordances in place. We are not setting up the stage for this theater to play out. So you can have the actors, you can have the script, you can have the intention, but the stage needs to be in place. Our cities, our neighborhoods, our buildings, our homes, our places set the stage. So when someone has to take a brisk walk, they shouldn't be risking their lives. I risk my life coming from Aloft to here. Twice.
That was scary.
Each pathway, right?
That was scary.
And you think about it.
Do you think it's a
actually
matter
really
of
difficult.
not paying enough attention to design? Is the common thread for some of the problems we've identified is that we don't put enough time into looking downstream of the impact of the things we design. Now, it might be a digital app. Will it cause people through the likes to feel bad about themselves? Or it could be the design of an environment or a building or the relationship among individuals.
Walter, I would argue that everybody in this room is a designer. We're all designing something. We're designing policy, we're designing experiments, we're designing apps, we're designing environments, and perhaps the challenge is that all of us are trying to change the world within a silo, and the silos just became irrelevant.
Well, I love, because this kind of wraps back to what Bruce Mao started out with us yesterday about design and how so much has been person-centered individual design. And the idea, what all of you guys are saying, the importance of community, the importance of being able to be connected to people. So really my question, sorry, I asked it like this, was what's the hurdles? It really should have been, what are you doing to actually move forward the tools and the opportunities and the resources, which thank you for all answering that way anyways. So that was really good. What do you think about though, like buy-in? In the wild, so we've had a lot of conversation, I think, about, and I've seen personally, most people have some type of stigma around their brain. They're afraid of even if I think I'm doing awesome in this world, what are you gonna tell me if I go through kind of an assessment? The idea that still the brain is treated as in the medical model, that it's about diagnostics, it's about treatment and about fixing a problem, even though there's a lot of performance kinds of elements that people are now onboarding a lot more. But what's the messaging that each of you kind of, and maybe we'll start with you, Jason, because this is a real thing, I think, in the military.
Yeah, so we have big hurdles with our guys. I mean, typically we're dealing with 20-something-year-old, 30-something-year-old men that are doing dangerous activities. Like, it's their job, is to do dangerous activities. And trying to get them to be vulnerable, trying to get them to seek help, trying to get them to trust that it's not going to impact their career. You know, when we go to the doctor, no one's going to think that that's going to go back to their boss and their manager's going to be like, oh, wait, I heard you got that bad lab result. You're out. You know, but that's the reality of their life. And that's not true in many, many cases. That is a false stigma that they carry. But there is the result is the same, which is we are seeing them so far down the pathway. You know, that at my treatment center, Intrepid Spirit Center, Camp Pendleton, the average person's about 30-something years old, right? Pretty old for a service member, and they're on average 5 years away from their most recent injury. 5 years. They've been walking around for 5 years. And that was opportunities for us to treat them. That was opportunities for us to provide them care before things derailed at home with their wives, before they lost custody of their children, before they got that DUI. Those were all opportunities we had to intervene, and we couldn't. And so I think we need to be trying our best to be progressive and to be forward thinking in how we get outreach. I'm sure we're talking about youth, right? The sooner you intervene, I'm sure the better, right? We need to be able to find ways to get people the treatment that they need and be preventative about it.
Yeah, a couple of things there. You know, one thing that I think is so important and has been heartening that we've seen, now we've supported 13,000 students on 50 college campuses across the country over the last 2 years, and we work with the NFL and professional athletes everywhere. Number one, these young adults believe in the science. They like the science. And it's ironic because they don't trust other institutions. They don't trust the government. They don't like organized religion. They don't like all, but they believe in the science and they're fascinated by it. So to talk to them in a way that respects that and that connects with them on that level has been great. But the way we're going to make progress here is really through it's the peer relationships. I'm sure it's true with the folks that you're dealing with. It's certainly true with our folks. Seeing that someone else has walked in your shoes, is experiencing what you have, and has bought into something that's working for them is a way to educate in a really big way. And there's been a lot of talk over the last couple of days about doing some kind of a movement or a campaign. How do we do it? From the ground up is, in my view, this is how it's going to work. Because we spent a lot of money and a lot of time trying to find all these professional messengers around all of this. We videoed, and believe me, athletes, actors, not politicians. And the kids want to hear, the students, they want to hear from other people. They don't care if they're famous or not. They want to hear from people who know what they've been through and who are doing something that's working for them. These kids, our group is peer-led. It's a weekly program. It's almost like AA for mental health, very, very structured. They talk to each other about their own stress management tips. Here, I audio journal. Here's what works for me. This is my Spotify list. How about this? My nature walk. This is what we need. So getting evidence-based things that we can actually get in the wild that are peer endorsed, I think could take this from here to here like that.
You know, one of my appropriate thoughts for what the challenge is based on the comment by William Gibson. He said the future is already here, it's just unevenly distributed. and I think there are fantastic solutions that are out there, and that's a fantastic example that you just gave, Liz. But how do we promulgate those fantastic solutions to overcome the inertia? And there's tools and techniques we can use. Noah Felstein is here, who is an epic designer of games to make things interesting and engaging, to leverage the social connections, to leverage the tools that are out there. I think the pathway is there. And I think one thing to be conscious of is that the tech titans are moving into healthcare. They're moving into wellness. And they know how to measure, they know how to scale, and they know how to distribute. So we have to help them, getting back to the design issue, design the right way to leverage this powerful technology. The way we interact with each other, the way we interact with technology, the way we interact with our automobiles and refrigerators and buildings is going to be mediated by sensing that understands our cognitive status, our emotional status, and our physical abilities, and adjust itself to us. And that's where the tech titans will take us. But we need to make sure they do it right, to design, to leverage the understandings that the people in this room have.
And I love that because it's almost like for the tech titans, you need to be think titans. Like we really, like the investment in brain health is so we can be thinking titans in some way, because you have to direct things towards the impact. Someone was asking about how do you define innovation recently. And for me, it's the most beautiful, shortest path to impact. It has to be the shortest path. It also has to be the most elegant, beautiful path to what's the difference we are trying to make, because it's so easy to be seduced by what's new and the fact that we can do things. But if you're not thinking about what's the difference we're trying to make, we get lost so quickly. And that conversation about, how do you change the narrative? I think you're doing it right now. I think the center is doing it with us every day, where you start big, you think big, but you work on something really small. Like Dr. Gupta talking about the walk in the end. I know the experiment we did was, we did all the brain health strategies in the world, and then we came back to, how about for 1 hour a day, you do one thing at a time? Yeah. 1 hour a day, one thing at a time. And that little thing resulted in 18% of reduction in multitasking in our own offices. We also told them, go to one place where you can do that thing best. Go where you need to go instead of trying to do everything where you are. So it's the big ideas, but it's the small, actionable things you can do in the language of the stakeholders who you're actually doing it for and with.
We have the 4 weeks. The first week is skills around building emotional intelligence, and there's an active listening exercise. And even the concept of active listening was brand new to all of these folks. And so we explain, it's just communication. So we've got an exercise, and it's, you get a partner, and for 3 minutes, I'm going to look you in the eye, and I'm going to tell you my story, and then you're going to repeat it back to me, and then you're going to vice versa. I'm telling you, the hands down, every kid said to us, 3 minutes is a really long time. Like to talk with nothing, with no phone, with no, the idea that you were actually going to sit there, but they love it, and it's amazing to see across the board. We assess them every week, and then at the end of the 4 weeks, and then we do focus groups and on. They say the active listening, it's like teaching them Mandarin, like this eye-opening thing. They've never sat even at the kitchen table with their parents and talked face to face. These kids have grown up, do multitasking, distracted, call it what you want, and this is the kind of, talk about tools and skills, simple things, walk in nature, talk to a friend, just incredible.
So how do we scale that? How do we take?
They're doing it. You know what's been fascinating, we have all these peer guides, it's a peer-led program. We go to campus and train these peer guides. Again, Jeff Ling and a great group of behavioral health specialists, a lot of sports psychiatrists helped us put it together. We train these peer guides on campus. They're usually kids who had some leadership role in RA or a team captain or something, and they run the groups. And what's happened now is that the participants who've gone through the program have now come forward to be the peer guides, and the guides have come back 1 and 2 and 3 semesters in a row to do it. The biggest barrier we have when you ask about is school bureaucracy, you know how the institutional biases against doing things that are common sense. I mean, just getting a bunch of kids together to talk about concrete skills and tools to help them. So the scaling is happening really because the kids are recommending it to their friends who go to school on other campuses, and now they're asking us for the program. And that's really how it has scaled. It has been purely through word of mouth. And a lot of kids who have written in and said, can you bring this program to my school? They know they need it. They want all of this. They want to be part, they don't want to feel how they're feeling right now, that's for sure.
I think it's interesting because I can think for all of you, there is the kind of the system, bureaucracy, institutional kind of way of operating or way of functioning within that, and then it doesn't always meet, or it hasn't always met the needs that we have now. And kind of as science has progressed and we get more data about really what works, and I mean, I think about the workplace all the time. Obviously, it's like this, we spend more time as adults in the workplace. And when you think about every single day your brain is changing, where is the place that is affecting that, impacting that more than any? It's the workplace, whether it's active duty military, school, I mean, right? Yeah. It's like that's their environment, and the workplace. And I think about how culturally a group of people, like when you say from the ground roots, because a group of people, individuals can start to see impact, but if systems around you don't, if systems are not gonna allow you to go to the Intrepid because you need to be doing, whatever your work was that day, or if you have, I always hear people in the workplace say, if I didn't multitask, I wouldn't have a job. And it's, when you really see what you're talking about, it's absolutely ludicrous to kind of see that this is not sustainable. Most people talk about it's not sustainable either. So talk to kind of the systems that you guys work within, but the people, kind of that friction that exists and the possibilities that are there.
What I'm finding is as we move new therapeutic and products out, both on the wellness side and on the clinical side, it's been wonderful to work with the U.S. Veterans Health Administration. They've scaled very rapidly. They've accepted innovations. They have a large distributed, sometimes hard to reach safety network of and they are making it happen with embracing new technology. So I'm very impressed by that. I do think that one important way to address the scaling issue is also to design for engagement. And I think we have to find ways to connect different communities with each other in a way that is impactful emotionally. I think it's one thing to have texting and typing, but it strips away emotions. And I think now as we're getting better at combining emotional impact in our way of interacting with each other, but not Zoom, not video conferencing, because that is a threat gesture to be looking at someone straight on the face. So I'm excited about the next wave of virtual world technology. Will allow us to be with each other in a more robust way, or to be in a forest, but to also convey our emotional content along with that, as opposed to having it be removed from us, which is what we're doing with technology now.
Yeah, I love what you said about the Zoom world and how the amount of cognitive real estate that goes into reading faces is huge. Yeah. Right? You actually spend a lot of time reading faces, and your brain is wired to do it because of the threat mechanism. So there's so much to unpack there, and that is the challenge of the modern workplace, because the digital and physical have converged in unprecedented ways. So for us, this whole effort of being living labs is, first of all, embrace the experiment. We're in the experiment right now. When you're in the experiment, you're constantly testing, and you're evolving and hopefully sharing. But if anyone raises a hand and say, we have the solution or the silver bullet, you're like, you don't even know where you're aiming. Where's the bullet gonna go? Right? So I think that's the key part of this beautiful time, like the opportunity. Learning environments are workplaces. Workplaces are learning environments. They're both, right? There is this confluence of different typologies on how we have, again, put things in boxes that maybe weren't the boxes to begin with, right? And for the modern day workplace, I have so many of my colleagues here who you can have a very long conversation with. But fundamentally, Liz Fallon, who's here, is going to tell you, we're addicted to our workstations. We're kind of addicted to multitasking and then going wherever we are and then sitting in one place and doing a million things. What we should be doing is moving around, getting the break, going to the place we can focus, going to the place we can ideate or collaborate, going to the place we can connect. I mean, the whole exhibit is about that. But the challenge, Jen, and you've seen it, is the systems in place. You need leadership buy-in from the beginning. You need to say, okay, we need the training first. Like, we need to know, what do we need to do? Which is what we're doing with the center. You need to know what places or affordances do we need to allow that to happen. But mostly, you also need new kinds of habits. There was a coffee in the morning that you got. There were rituals that are missing now. We need new rituals for this new workplace, however it gets defined. You have a question.
Well, and I think you're also helping us come to a realization that we need to be iconoclastic.
Yes.
It's not enough to do incremental work. In order for it to really transform the inertia that's out there, the people in this room and our colleagues, we need to push harder and break down things.
Yeah.
Because the inertia will get us otherwise.
And the vocabulary too, right? The words we are using, like some words are not relevant anymore, right? Like workplace. Is there only one place where we work? Like, what are the words that we really need to look at very hard and say, is our vocabulary fitting the life that we have right now? And I think that goes back to really getting into what is the impact you want to make. And if you want everyone to be at their highest performance, if work is where you build the cognitive muscle, if work is my gym to becoming better here, that's a totally different thing. I would go to whatever gets me to my optimum performance, because I'm not sure my PJs are cutting it. Right?
From the waist down.
Exactly.
Yeah.
Right? No. I mean, there are issues here.
Can I say, I want to take your question and loop back a little bit to one of the questions that someone asked Sarah yesterday about corporate leadership and your point about where all this comes to. So since this is all a matter of public record, I'll tell you, because I think CEOs should be rewarded and recognized. When we first launched this program, Brian Moynihan himself, personally, he's the CEO of Bank of America, pledged $1 million for us to bring this program to HBCUs around the country. And right shortly after that, Jamie Dimon at JP Morgan gave us $500,000 from the company and $250,000 himself, and it just gave us another $300,000. The NFL gave us quite a bit of money. My point in saying this to all of you is that these companies recognize that the next generation of leaders is not equipped to work in the workplace the way they used to. They don't have this. They don't even know how to work in a group. They don't know how to compromise. They don't know how to manage boundaries. They're stressed. Their decision making is, very myopic because they're not used to, they haven't been forced to work in these environments. These corporate leaders know this, that whether it's, and I don't just say that because it's about their bottom line, although that's certainly part of it, because they're inheriting kids right out of school who are very competent in their areas of study, but literally cannot work in the kind of environment they need to work in order for the companies to be successful. But they're also parents themselves. And Sanjay touched on that when he was talking about his daughters. Every single person I know, when this topic comes up, says, oh, this was my kid, my niece, my nephew, someone, straight A student, but then he had to drop out, or did this. The good news is everyone's paying attention, and I think the corporate leadership's there, and whether that's redesigning the workspace, getting the best possible tools that they can get and devices, or just doing things like sponsoring programs like ours, so that these kids, long before they reach a crisis, are prepared and confident and smart and eager and optimistic. It's there. They're there.
Well said.
Yeah, well said.
They are.
Yes, agree. Were you going to say something
and
else?
we're lucky, right? Because we have our CEO and president in the room, right? And thank you, Sandy. But there is a huge difference when that message and the simplicity of the message goes top down and is supported bottom up. So our success is in the narrative that's bottom up, that's really happening, but it has the top down support which gives you the scaffolding. Mm-hmm. And that scaffolding, I think people understand. Any organization understands the scaffolding of support that it has in any initiative. And if it's not there, it just falls through.
I think we also have to leverage the power of media.
Yeah.
What changed smoking, what changed littering, what changes behavior and attitudes, social attitudes, is our movie industry, our television industry, the novels that people write. So we need to get the storytellers to be part of affecting this change. And I also think we have to start very early. It's wonderful what you're doing with the age group you're in, but I know from my friends in pediatric care that the pandemic has created a big problem. Children did not have a chance to do their social emotional learning skills, and they're coming up through the ranks with a huge issue of depression, anxiety, etc. So we have a tidal wave of cognitive aging issues, but we also have a big problem, an earthquake of issues with our youth. And we have limited time to come up with redesigning things to address that.
Right, yeah, time it's urgent. So you brought up, I want to talk about Brainomics for a second. So we've heard a little bit about Brainomics, and everyone in here knows the cost burden of poor brain health and brain disease and brain injury and on caregivers and the workforce and all things like this. And you brought up, like, people will support things because they care about people and bottom line. So what our Brainomics venture is trying to do is really look at what is the cost benefit of good brain health, good brain performance. So I know maybe you have some numbers, but maybe you don't. And so if you just talk to what do you see the impact, cost benefit wise, of better brain health within each of kind of the constituents that you work with? Jason, go first.
Yeah, powerful question. And obviously, our world runs on money. I operate in a weird world where the dollar of healthcare is not tied. So most hospitals you work at, most patients, there's a RVU, there's insurance companies involved. That's not how we work. But at the end of the day, we do have to think about cost effectiveness. And for me, I have to think about every time that patient is with me, every time that patient's with another doctor, that's a time that patient's not at work. And we're paying that soldier, we're paying that Marine, we're paying that sailor to be in that doctor's office with me. So we need to find healthcare that is not only effective, but also efficient, because we're paying for every person in that room, right? So we actually just finished our clinical trial with Sandy and looking at the utility of basically an adapted version of SMART. And we compared it to a traditional cognitive rehabilitation program, right? So for the most part in the military, how we've treated cognitive disorders, which is one of our most common symptoms and most common complaints of our service members, is forgetfulness, inattention, problems paying attention, problems with decision making. And we treat that for our Navy SEALs, for our generals and commanders and admirals. We treat them the same way we treat grandma who had a stroke and who's trying to learn how to remember to take her medication and who's trying to remember her shopping list when she goes to the store. And those are obviously different treatment goals, right? Our outcomes are very different. And so what we were hoping for when we adopted SMART is that we're gonna find a better treatment that gets there faster. And sure enough, when we look at it, we looked at cognitive impairment. So when we have someone who has a cognitive disorder, right, whether it's from a brain injury or whether it's from substance use or psychological disorders, the amazing thing is we're at 75% effectiveness, right? Whether they're going through a traditional approach or whether we're using SMART, we're getting similar outcomes. Their performance in their job, right? We had their supervisors rate their performance. Similar outcomes, right? The big difference is in their traditional approaches, they're with us for 6 weeks. 6 weeks that they are under treatment, 10 hours a week. Do the math, that's a lot of hours. Compared to SMART, which was much more enjoyable for one, but 4 weeks in durations. The overall cost savings that we had was a 60% reduction. 60% of cost savings for having someone go through a SMART program that they enjoyed more versus that had, I believe, more generalizability, more adapted, more application to their duties compared to our traditional approaches. And that's the innovative thinking, not to steal from a SMART concept, but that's the innovative thinking, right? Where we need to think about new solutions that get to the similar outcomes or better outcomes that can be faster and save us time and money. And that's, I think, a really important pathway.
Thank you. Anyone, what else? Cost benefit.
You know, I work with a number of early stage companies that are developing the next generation of wellness and clinical products. And they often don't take the time to design for cost effectiveness. They'll come up with something that will save lives or will improve brain health, but they don't design for how it's going to be. And again, it's a lack of knowledge on their part of how to do that measurement. I think we need to make sure that the academic groups and the companies that are developing new solutions, bringing them forward, design for impact on the work environment and cost savings too. And it's a task, but often overlooked.
I agree. I think the experiment we are doing right now is very much around cost benefit. You can see some of the benefits that are mentioned up there. The improvement in the Brain Health Index was a big one. But I'll get down to the why first. We're a collection of creatives, right? We are designers, architects, planners, researchers, what have you. Our chief currency is our thinking. That's our currency, like that's what we go in the world with. So the value proposition is so strong. Like let's talk about the cost and the money, but just think about the value proposition, that what I'm bringing to the world is my ability to think about a wicked problem in very, very innovative ways and provide a solution that is actually implementable. So I need to protect this. This is my chief asset. Most knowledge workers, most learning environments, that's your chief asset. So the value proposition is clear. How do you measure it? That becomes the tricky part, right? And especially when you look at all of the confounding things. The training, how do they continue to follow what they have learned in the training? How do they maintain the habits, the policies and the processes you put in place, and the places that all of this happens in? So I think that's the challenge. So again, I was giving that very simple statistic that we know that we have an 18% reduction in multitasking. We know that the cost of multitasking is it can be up to 40% on productivity. Take your annual revenue number, and you can calculate very quickly in millions how much are you saving. That time that you're buying back by being effective is going back to life, which means you're living a better life or a thriving life, and that's the benefit of life, because you've reduced the cost of work, right? And so those are calculations we're doing right now. These are not easy. We know how much data we're actually pouring into and trying to get, but the value proposition is an easy one. The value proposition is not complicated. But how we get the evidence base, that platform of truth, that's going to take time, and will take a lot of data sharing. And a lot of the data lives in different places, and I think that's what we are trying to navigate through right now.
So maybe a solution is taking a federated learning approach and coming up with better measurements that are related to the new approaches that you have, right. Measuring creativity, measuring idea generation. Yeah. And I think we are on the precipice of being able to do that.
Sure, measuring IP, for example, right? Yeah, absolutely.
Okay, all right. We have 5 minutes left. Thank you guys for a very exciting kind of conversation. I hope everyone got some nuggets and some insights on this. Do we have any audience questions? Yes. Can we? Yeah. Go, go, go.
Hurry, time is money.
Go, go, go.
Just go ahead.
My question is really about the workforce, and it was a conversation I had over breakfast this morning, and it seems that we have a workforce that is resistant to coming to a workplace. They are missing out on collaboration, on peer interaction. So that, to me, is kind of a big sticking point in terms of how we get people back together again in some environment where the environment is conducive, the relationships are developed. So could you speak to that?
Isn't that the million-dollar question today? Right? I think for the workforce to feel motivated to come back, the workplace has to have those affordances, the work culture has to be in place, and you have to have a very clear purpose. Very clear purpose. Why am I here? What am I doing? Who am I doing it with? How am I getting these benefits? And social connection, like we were talking about it, is it a steroid for social connection? Right? Not everything is always based on what the individual has recognized as their need. Right? We understand that. I think that is a challenge. But there is also a huge shift that has happened that we need to be very, very cognizant of. And that's why we say that this is an experiment where you have to embrace, you have to give different value propositions, and you have to allow it to unfold. That's why we are doing living labs. Living labs, the premise is we are creating incentives to come. You can come to a place where you can ideate, collaborate, be with each other. When needed, you can focus, but it's not going to happen if you come to the place the same way you used to come yesterday. It's the same place you used to come to yesterday, and you're working in the same old way that you used to yesterday.
I'll just say, I think that really gets down to leadership too.
Yeah,
Right? We, as a leader, we can no longer just say, you need to come, you need to show up at 9 o'clock, because we'll just lose it to a company, that asset, that person, to a company that doesn't do that. So we have to make it a way that it's meaningful for them to come to work. And maybe that is the connectedness.
How about their
part.
paycheck? I mean, hello?
Well,
No, it's unbelievable. This is what is really the big problem. We are not helping these young people by telling them that they don't have to go to work, or they don't have to go to school, or they don't have to turn their paper in on time. These schools across the country, the big dilemma now, the faculty are protesting because the students say, I can't meet the deadline, I'm too stressed. So the administration says to the faculty, then why don't you give them an extension? On and on and on. Same thing with workplace accommodations. If you talk to these folks individually, they know they know they should be going to work. They know that they need skills to work in this environment. And this gets back to Walter's point about starting when they're younger. All of this stuff we're talking about, early intervention, helping train them, is what needs to be done in order to prevent exactly the situation you're talking about now. If you have an employer and he wants you to come to work and here's your paycheck, you got to do it. And that's just the way it is. And look, I don't know what else to say.
Okay. No, thank you, Liz. No, I agree. I know this is a very hot topic, obviously, right? It is. And I think it's really important to be thinking about to the whole point.